This is my acceptance letter to participate in the project.
On paper, it was an unmissable opportunity. Move your career to Canada for a much more competitive salary.
This is the study permit and the work permit. Like all international students, I'm allowed to work 20 hours a week.
We're going to call this man Haruna. He wishes to remain anonymous for fears of reprisals from a professional sector in which he still hopes to succeed. Haruna was recruited in Africa to fill the shortage of healthcare workers in Quebec. He thought that by coming here for a refreshment course, he would soon be able to restart his nursing career. But after failing his local exam, everything fell apart.
It says, if you want to, you can sign a limited license as a care worker for 3 years, or else go back to the country. Care workers are the people who help the elderly with drinking, bathing, and all their daily needs. Anyone can do that.
In a matter of days, Haruna lost his student allowance, his study and work permits, and his health insurance. He now feels he is being forced to become a nursing home assistant rather than getting to take the exam again.
My choice would be to continue my training, to continue being a nurse. I left my job back home to come here and be unemployed, in a precarious situation. It's not easy at all. I wouldn't wish it on my worst enemy.
Like Haruna, many of the nurses applying for Quebec's skills recognition scheme feel like they've been betrayed. Faced with an increasing number of calls for help on WhatsApp, this Franco-Ivorian nurse, who has been living in Quebec for several years, began compiling testimonials, despite not being part of the program herself.
La même journée, je reçois un appel de mon école me disant que mon permis d'études m'a été retiré.
In just a few days, Roslyn posted 3 videos on the internet to highlight the situations of the most vulnerable candidates.
They face situations of abuse, of racism.
Her employer, a regional public hospital, has just fired her for damaging its image.
They were told over and over again, you smell, black people smell, use deodorant, it's going to be hot. There were also illusions about black people having STDs more than anyone else. Some were offered condoms so they wouldn't give birth because they were recruited to work. They were forced from the program and the project. Some parents end up at food banks. Many say they wouldn't have made the choice to give up their jobs in Africa and move here.
The school Haruna attended refused our request for an interview. One of the program's regional managers agreed to meet with us. She told us that if people refuse the retirement home jobs, a student who has failed must be able to survive and find training on their own in order to complete the course.
From the moment that they want to go and enroll to acquire the skills that they're missing from the training program, at that point it's really up to them to make their move. Unfortunately, we don't offer training in all regions. So it's more difficult for them to re-enroll here in our region. But there are other regions that offer that. So it really is up to them to take that step.
With the first cohorts of candidates boasting a success rate of over 90%, the question of how to deal with those who fail, nearly 15% in the third intake, seems to have been forgotten. Those who, like Haruna, refuse the only nursing home attendant contract offered to them must therefore survive without income or a work permit, and then, if they can find one, retake the exam before their visa expires. All that in sometimes under 2 months. The Maison Internationale de la Rive-Sud near Montreal helped several of the African nurses who arrived under the Quebec program. Its general manager says the conditions under which these expats are welcomed need to be reviewed.
They're not the same type of students as the classic ones we're used to welcoming, studying, working, taking care of their families. No, they have to have scholarships. And there are ways of seeing how, afterwards, they can repay part of these scholarships so that these people can study in the best possible way, succeed, and ultimately practice here. We're an aging society and we need all these people to continue to grow. And when these people arrive, we have to look after them in the right way.
Launched in 2022, aiming to recruit 1,000 French-speaking nurses in Quebec, the program has cost authorities $65 million, and they assure us that everything possible is being done to facilitate the success of those taking part in the project. Nearly 500 of these new nurses have been placed in Quebec's healthcare sector. Similar projects for other work sectors were recently suspended following a UN report in which the UN Special Envoy accused Canada of promoting modern forms of slavery through its temporary foreign worker programs.
Including victims and survivors.